In the last part of this lecture, we just went through the history of social welfare policy, and so in this last section, in this third and last section, we're going to look at the organizing schema that we're going to use for this class in terms of how we classify all the different policies. We're going to distinguish between social insurance programs on the one hand and public assistance, and what that means exactly here. Okay, but first, just in terms of background. So generally speaking, when we think about social insurance programs versus public assistance programs, social insurance programs are much larger in scope, right? So when I say larger, I'm talking about the number of recipients of social insurance benefits really outnumbers by a lot public assistance programs. So just in terms of the numbers of recipients on a per program basis, or if we sort of look at all the social insurance programs together, there's really no comparison. In terms of the amount of spending that we do, we're closer to the trillion mark in terms of social insurance spending as opposed to public assistance spending, which is not even really about half. Well, with Medicaid nowadays, it's probably about half of what we spend in terms of relative to social insurance spending. And if we take a closer look at public assistance spending and public assistance programs in general, the trend really has been to shift the administration really into the tax system. So we're scaling back. Certainly since the late 1990s and welfare reform. We had a major welfare reform in 1996 that was implemented by 1997, a historical landmark really for us, right, in terms of social welfare policy history. But since that time, really, we've scaled back public assistance benefits to a great degree, and more, especially with healthcare reform. You'll note that we now have a tax penalty assessed on businesses and individuals alike for non-compliance with the new healthcare scheme. But more and more, we're starting to see administration through the tax code, right? Administering public assistance programs to the tax code. I think, personally, on a personal level, I think it's a good move. One of the problems that we've seen over the years, sort of an intangible problem that we've seen over the years with our with our welfare system and our public programs in general, is that of stigma, right? We noted this sort of targeting isolation stigma that Professor Elwood notes. And by administering programs to the tax code, I think we get away from distinguishing the poor and the non-poor. Everyone pays taxes, and so I think it's a good move that we're trending more towards administration of our public programs to the tax code. All right, so getting into the basic features, the basic distinctions between social insurance and public assistance. So first, I'll note here that social insurance programs tend to be universal in nature. And so let me tell you what I mean by universal. It doesn't mean that everyone necessarily receives under a universal or social insurance programs. It just means that social insurance programs, generally speaking, are readily available, right? Are potentially available to anyone. But when we say anyone, there's still certain requirements often. Often you still have to be a citizen or at least a lawful permanent resident for at least 5 years typically. And when we talk about anyone being potentially available, in the case of social insurance, it probably means that it means you have to work, right, throughout your lifetime. But that's what we mean by universal coverage. And typically, in the case of social insurance programs, these are contributory in nature, right? These are contributory schemes, meaning that you have to put something in to get something out of social insurance programs generally. And the way in which social insurance programs and public assistance programs are funded, those are distinguishable, certainly. In the case of social insurance programs, we have what's called, I'm noting here, dedicated or earmarked financing. So what we mean by that, basically, is that you have a tax that's assessed specifically for one of the social insurance programs. So we have a separate Social Security tax, right? We have a tax that's assessed specifically for the social insurance program. We have a tax that's assessed specifically for Medicare. Right? We don't have specific taxes that are assessed for public assistance programs. Public assistance programs are funded out of the general revenue, out of the general treasury, out of the state and federal treasuries, but social insurance programs have very specific taxes that are assessed for specific ends, right? And so that distinguishes social insurance from public assistance in the way of eligibility, in the way of financing. And then we have a couple of issues here, adverse selection and moral hazard. So in the case of adverse selection, what that refers to is in the case of an insurance program, so think car insurance for a second here. So this would be an enrollment issue, right? If it just so happened that in terms of some car insurance, let's say we didn't have a law in place that required everyone to have car insurance. You would think, right, just logically speaking, you would think that only the people who are most likely to get into car accidents would enroll in private car insurance plans, right? That's the way we think about health insurance with private health insurance systems. When we historically left it up to private insurers, we had a largely private system in place in terms of the working age population. Only those people who are likely to use health insurance would probably enroll in private health insurance coverage. That was a problem. That's what was making it expensive, right? Because if only the people who use it a lot are enrolling, then certainly there's a lot to be paid out in terms of car accidents or in terms of health issues. And so the basic idea here is that social insurance, right, by forcing everyone, right, we force everyone, we've passed laws, state laws, that make sure that people are covered, that people have car insurance. And more recently, in healthcare reform, we make sure that the working age population, that everyone has insurance, by forcing everyone to obtain insurance, to enroll in insurance, right? That's to address this adverse selection issue, right? And in turn, to address the cost issue, to keep costs down. And so it's thought that social insurance overcomes this issue of adverse selection. Now, moral hazard is another sort of related issue. This is not about enrollment in insurance, but it's about once you have insurance, it's about overuse of that insurance or the use of that insurance. That's a moral hazard problem. So once again, thinking in terms of car insurance, I think it's easy conceptually to think in terms of car insurance. Let's say you have a tendency, let's say there were no deductible, right? In the purest, if you're designing a system, there's no deductible, and you have this car insurance. I know for me, every time I parallel park and I get a little scratch in the back of my bumper, right, in my back bumper, I have this longing to want to call the car insurance company, Progressive, and get that fixed every single time, right? That's what we mean by moral hazard. You know that you have insurance, and so you're likely to overuse it. And so it's thought that social insurance in designing and being smart in the way that you design social insurance, like some private insurance systems, that we can overcome the issue of moral hazard, right? And so car insurance, you have deductibles in place. You have maybe a $500 deductible or a $1,000 deductible so that you don't have a tendency to call the insurance company every time. We have a similar type of disincentive to overuse our health insurance or overcome moral hazard in our health insurance systems, right? In our public health insurance systems, Medicare, for example, right? Medicare, your overnight hospital stays, you have to pay the first $1,000 so that there isn't this incentive to overuse it. Medicare Part D, once again, you have a certain amount of annual costs that you have to bear first before the insurance to kick in, right, to overcome this moral hazard issue. Okay, so generally speaking, social insurance programs are thought to overcome issues of adverse selection and moral hazard that typify private insurance problems, just conceptually speaking. And so just sort of a quick recap here. Social insurance programs certainly are government sponsored, right? We force people, government steps in. So in the case of our new healthcare system, government steps in and says, if you don't get insurance by this year, 2014, right, you get dinged in terms of the tax system. Same thing with employers by 2015 is the new rule. Government sponsored, we have near universality, meaning that we have benefits that are potentially available to anyone with a few caveats, right? Are you a U.S. citizen? Do you work? And then, of course, there's a very specific funding mechanism, right? We have dedicated earmarked financing in the case of social insurance programs. And then we overcome these private insurance problems in the way of adverse selection and moral hazard. That's social insurance in a nutshell. And I give you some examples here of social insurance programs. You have old age survivors insurance, right? An insurance program for old age individuals and their survivors, right? There's a disability portion to our Social Security program. That's a disability. You could just slide the D right up next to the S there. And then our Medicare system, right? You could just slide the H right next to the D, right next to the S. The Medicare, the hospital coverage, the overnight hospital stays that are covered under Part A of Medicare. That's an insurance mechanism. And then unemployment insurance, right? UI, certainly a social insurance mechanism. You don't realize it, but your employers will pay into a state unemployment insurance little pot of money there, and that'll pay out if you lose your job. And so workers' compensation, another program based on insurance principles. So just a few arguments here about some of the advantages of operating a social welfare program through insurance principles as opposed to public assistance principles, which we'll get to in a second here. This concern about work effort that we noted here, right? I noted before in terms of security and work, where government gets too involved, the work incentive goes down. It's thought that social insurance programs overcome any sort of disincentive to work, right? It's not conditioned, these programs, on how much you work necessarily. Certainly in terms of caregiving responsibilities, one of the arguments in support of social insurance type structures is that you have the sandwich generation that has to care for the elderly and maybe kids as well. And so what would happen, right, if we didn't have our Social Security program? One of the arguments, and certainly other arguments out there, a lot of different arguments for why social insurance might be preferred to a public assistance type scheme. In terms of family structure as well, right, addressing those conundrums that we noted in the first part of this lecture. All right, so in this section, we're talking about public assistance programs and the typical characteristics of public assistance programs. First, in terms of eligibility. So in the way of social insurance, we noted that there is a contributory mechanism in place. You have to put something in to get something out. Well, to become eligible for public assistance programs, you typically have to pass an income or and/or an asset test. That's what we mean by means testing. The program will check your means and see what sort of means you have to get by, to make ends meet. And so first is a means test to become eligible. And then, of course, the financing for public assistance programs is going to be different from that of social insurance. We noted that in the case of social insurance, you have dedicated taxes, right? You have specific taxes assessed for specific purposes. But public assistance programs, they derive their funding from the general treasury, from the federal and the state treasuries typically. And within this schema here, within this sub-schema of public assistance programs, we sometimes distinguish between entitlements and non-entitlements, right? We alluded to these things before. In the case of entitlements, if you're found to be eligible, then there's an obligation on the part of government to provide you with the benefit, with the major benefit that's offered for that program. And so we know here, SSI, if you're eligible for SSI, if you're found to be eligible, right? This is a federal assistance, a program offering cash assistance to the federal government with state supplementation. They must provide you with benefits, right? If you're found to be eligible, Medicaid, if you're found to be eligible for health insurance, for public health insurance under Medicaid, they must provide you with coverage. And same thing with food stamps. If you're found to be eligible, the government must provide you with your link card. But of course, there's some programs, even if you're found to be eligible, there's no obligation still on the part of government, on the relevant government unit, to provide you with benefits or services. And that's the case of temporary assistance for needy families, our welfare program. Our supplemental children's health insurance program, there's no obligation. It's only if the state has enough funds that they must provide health insurance benefits to those kids who are not necessarily poor, but maybe in the working poor category. And then Section 8 housing, right? We noted that often there are long wait lists, right? There are often long wait lists for certain government programs, this one being the major culprit here. But there's no obligation on the part of the local housing authority to provide you with housing, even if you're found to be eligible. So that's the characteristic of a public assistance program. We're going to just fly through here the last parts of this lecture. And this is getting at how much we spend, right? So the trends in spending in the way of social insurance and public assistance. And this is just sort of a sweeping way of getting through sort of the 70s, 80s, and 90s, the recent history of spending on social insurance and public assistance programs. So in the way of social insurance programs, spending increases every year. There's no question about that. Spending is going to increase in the way of social insurance programs. It's just a matter of by how much, right? And so you'll note that in the 1970s, those annual increases were quite sharp, right? So large increases in the 70s, more modest increases in the 80s and 90s. And in the last decade, we had a slight uptick in the annual rate of increase in the way of social insurance spending. That's all I'm saying here. I'm just picturing sort of line graphs here. And then in the way of public assistance programs, I'm distinguishing here, there's a separate sort of trajectories here based on whether we're talking about in-kind transfers, in-kind spending versus cash assistance spending. So in the way of in-kind assistance or non-cash, right? So things like, I note here, things like food stamps, that's sort of a hybrid, right? Because you have cash value on your debit card, but certainly Section 8, right? Housing, that's not cash support. And then Head Start, that's not cash support, or Medicaid, that's not cash support. So in the way of in-kind transfers, these things mirror the trajectory that we saw under social insurance. So we had large annual increases in the 70s, more modest in the 80s and 90s, and once again, a slight uptick in the 2000s. But really, the distinguishing feature here in the way of historical spending on these different programs, so in the way of cash public assistance transfers, we have increases in the 70s, 80s, and 90s. And so the bottom line here is that in the 2000s, with our new welfare system, with welfare reform in 1996 being implemented in 1997 for the very first time in our history, so in the 2000s, we saw a decline. We actually saw a decline in the amount of cash transfers engaged in by our government. So that's really the point of this discussion here. Okay? All right, so that concludes the first lecture on history, on the historical context of social welfare policy. And so next week, we'll get into the economic and political context of social welfare policy.